carcinoma. And first of all, we will be talking about the T. So here we have T1, T2, T3 and T4. Okay, and T4 again has subsections of T4A, T4B, T4C and T4D. T1, sorry. Now T1 involves any tumor that is less than 2 cm in dimension. T2 will be those that are between 2 to 5 cm, and T3 will be those that are greater than 5 cm. This is very simple and I don't think there should be any confusion in this. Let's come to T4 now. Now T4A. T4A is those tumors that involve the chest wall. Right. Those that involve the chest wall. Now here question comes mostly in Viva, that what do you think is the chest wall? So chest wall constitutes the ribs, the intercostal muscles, the pectoral muscles and also the serratus anterior. When the tumors lie in the lower outer quadrant, we have to examine their fixity to serratus anterior as well. Okay. Then T4B. T4B are those tumors that involve the skin in the form of ulceration, satellite nodules and pure orange appearance. Right? These 3 points are very essential. And here comes a very common MCQ question, that is nipple retraction also included here? And the answer to that will be no. Nipple retraction is not included in this classification. And T4C is T4A plus T4B. That means those tumors that involve both the chest wall and the skin. And T4D is inflammatory carcinoma. Right? So T classification is a simple one, not very confusing and not very difficult as I think. Other things like TX is those tumors that can't be assessed, cannot be assessed. And TIS is carcinoma in situ, which involves DCIS, LCIS and also Beckett's disease. Right? So that's for T classification. I'll be talking about lymph node classification in the next video, and then we will have a brief view how to stage the tumors finally involving the TNM classification. Right? Now before we learn about the different stages of lymph nodes involved in breast carcinoma, first of all we must know about the type of lymph nodes in the axilla and their level. Now for that I have this diagram where you can see we have level 1, level 2 and level 3 lymph nodes. Level 1 lymph nodes are those that lie lateral to the P minor muscles, level 2 are those that lie posterior to the pectoralis minor, and level 3 involves those that lie above the P minor muscles. Now in level 1 you have the lateral group, the anterior and the posterior group. Right? Anterior group that you feel along the P major muscle, and the posterior group is that you feel along the posterior axillary fold. Right? And again level 2 is the central group of muscles, and level 3 is the apical group that is further, when you push your finger further up in the axilla while palpating, you may feel the apical group. And this if apical group is quite enlarged, you feel actually you will feel it in the infraclavicular area, right, above the P minor in the infraclavicular area. Here you may feel the apical group. Okay, so now let's talk about the different stages. N1 will be axillary lymph nodes, palpable axillary lymph nodes that are mobile, not fixed. Okay, and here we are not talking about the size of the lymph nodes. Here we are talking about the level of the lymph nodes involved and their fixity, or whether they are mobile or not. So N1 is ipsilateral axillary lymph nodes that are mobile and not fixed. In N2, if the lymph nodes are fixed, they come under N2. That means N2A will be the axillary lymph nodes that are fixed to each other or to the underlying tissue. Right? Fixed to each other or to the underlying tissue. N2B are the internal memory nodes. Involvement of the internal memory nodes with or without the axillary lymph nodes. Now this is a very important line which you have to remember, with or without axillary lymph nodes. However, I must tell that you can never know about the internal memory nodes in clinical examination for sure. There's no confusion in that. So I find this very vague. You will never know by clinical examination whether the internal memory lymph nodes are involved or not. So let's talk about the N3 stage. N3 stages. N3A is when you can say the apical lymph nodes are involved. That means the ipsilateral, intraclavicular, lymph nodes. This one, right? This one. That's N3A. N3C. I'll jump to N3C because it's easier. N3C will be similarly ipsilateral supraclavicular lymph nodes. Okay? Ipsilateral supraclavicular. And N3B is when N3B is similar to N2B in a way. For ease of remembrance, you link it to N2B. N3B is when you have internal mammary lymph nodes with axillary lymph nodes. Okay? I mean, here it was with or without, and here you have with. I mean, if internal mammary lymph nodes are palpable along with the axillary lymph nodes, right? So that's it. Again, it may seem very difficult to remember all the stages of lymph nodes, but if you try to remember it according to the way you palpate the lymph nodes and their characteristics, then you will very easily remember this. So once more, a brief recap I'll give. N1 will be lymph nodes. If you're palpating the lymph nodes and they're mobile, and the axillary lymph nodes, then it's a N1. If the lymph nodes are fixed to each other in the axilla, it's N2. And if the lymph nodes are either infraclavicular, then it's N3A, or if it's supraclavicular, it's N3C. And internal memory lymph nodes are not generally palpable clinically, are never palpable clinically. Okay, so you know what's N3, what's N2, and what's N1, right?